Hello, viewers. Welcome to the CSR Universe Leaders Talk segment. I'm your host, Ruchika Kumar, and this is a platform where we engage in meaningful conversations about the power of social impact. In this segment, we explore the inspiring journeys and impactful initiatives of individuals leading the charge in the social development sector. Today, we'll delve into the transformative power of healthcare and communication by exploring the inspiring work of the Heart Care Foundation of India. And we warmly welcome our distinguished guest, Ms. Naina Aggarwal Ahuja, who's the founder of Point Communications. And she's also the Trustee and Communications Director of Heart Care Foundation of India. Many, many thanks for joining us, Neha, and giving us this opportunity.
Thank you so much for having me here, Ruchika. It's definitely a pleasure being here.
Great, likewise. So, before we delve into the Q&A session, for our viewers' benefit, just allow me to provide a brief overview of both the organization and, of course, Naina's background. So, founded by the esteemed late Dr. K.K. Agarwal, a national awardee, philanthropist, and cardiologist, HCFI is dedicated to revolutionizing healthcare and promoting well-being across India. Through their flagship projects, they spearhead mass health education, research, and ensure treatment accessibility for all. And taking this forward, this remarkable effort is Naina Aggarwal Ahuja, a visionary leader who embodies the perfect blend of entrepreneurship and philanthropy. As the founder of Talking Point Communications and a trustee of HCFI, Naina's role is critical and central to driving the organization's mission forward. With a distinguished team of trustees and founders, including Dr. Veena Agarwal and Mr. Nilesh Agarwal, Naina's collective expertise, vision, and dedication have been crucial in shaping the organization's success and impact. And her expertise is invaluable. Her academic background includes a master's degree in international public relations from Cardiff University and a bachelor's degree in political science honors from Delhi University. This, coupled with her professional experience at Edelman, India, a leading global PR agency, and collaboration with renowned NGOs like the Lumba Foundation, which positions her perfectly to champion the organization's cause. So, viewers, join us as we delve deeper into Naina's inspiring journey, exploring the powerful intersection of communication, compassion, and community impact. So, Nana, a hearty welcome to you once again. And before we, start delving into, what the initiatives of the HCFI are and the mission, the goal that is aligned with the broader objective, I would want you to first tell me, your father has been an inspiration for the entire country, and he is a legend still because his online consultations and videos during the pandemic were so viral and they had actually saved millions of lives. And in fact, we were glued to his videos, taking guidance from him. And he has been an inspiring figure for all of us. I'm sure definitely he is the biggest inspiration for you.
Yeah.
So, as someone deeply involved in the organization's impactful initiative, can you share your inspiration behind the kind of work that you're doing in the organization? And also, if you could tell me the invaluable learning experiences you've received from your father and also gained through the dual roles that you are playing, taking charge of the communications as well as healthcare advocacy.
Sure. So I grew up in a household of doctors. So healthcare came very, very naturally to us. My father was always
Absolutely.
made for, something much, much bigger, and that's something that we knew since we were kids. Both me and my brother used to say that, he's not a businessman, he's not a general doctor. He just wants to kind of impact
Hmm.
lives and make a difference, and that's what drove him always, and those are the values that he kind of gave us and inculcated in us. So ever since we were children, we were involved in social work. I remember even with the Heart Care Foundation of India, when I was in high school, I started a caliper donation fundraising camp, and we would donate. We would help people who weren't able to walk, who had been in accidents and things like that. And for us, summer projects were really figuring out how do we help others, right? And
Mhm,
those are the kind of values that we were given. I started working very closely with my father with Heart Foundation of India, almost a decade ago, trying to formulate communication strategies and trying to figure out how do we um, really increase the impact that we are making, and how do we help different people. Um, Through the NGO, honestly, of course, his how he passed during the pandemic, the impact that he made was all extremely sudden, right? He
Right.
was there were millions of people who were listening to him. There were thousands of people logging on to a Zoom platform just to get consultation. Especially during the second wave of the
Yeah.
pandemic. So we were all at the back end helping him. I would help triage patients for him along with the other doctors, line them up so that he was able to give consultation faster. My mother, who's a doctor, was doing night shifts. So while he would work
Mm,
through the day, she would take on the patients coming in the night, and wake him up and ask him if there was some patient who was serious. So we were
mm,
all kind of stepping in and figuring out how do you help during the pandemic, and how do you ease the pain and the suffering that so many people were going through, and that's how, as a family, we really stepped up. Unfortunately, he fell sick, and he
mm.
suddenly passed away. Honestly, we took over from him overnight. The next morning itself, we were back to helping people. We were trying to figure out how do the programs that were being carried by the Heart Care Foundation of India did not stop, because we were in the middle of the Delta wave, right? Which was the people were we were helping with oxygen concentrators, we were helping with hospital beds,
Yes.
we were helping with
Mm-hmm.
medical consultation. We had trained about 3,000 healthcare workers to be COVID educators.
Mm-hmm.
3,000 people suddenly didn't know where to go. They didn't know who to ask for help because patients were calling them again and again. We had a lot of doctors who were volunteering with us at that time. So they also stepped in. They started, taking over all the patients. They continued to provide free medical consultation. They continued to kind of see all those patients who were looking at us from every part of India and the world for some sort of COVID advice. So that's really how this is Heart Foundation for India, for us as a family, is something to keep his legacy alive. So that's all the programs that he started continue till date, and we can talk about the different programs that were running going forward,
Mm.
this conversation as well.
Right.
But the base of everything was laid by him. We're just people who are executing it and carrying forward the programs that were still running.
Yeah, I think he was the biggest motivation for a lot of doctors also, apart from his family and apart from the citizens of this country. I still remember that he had urged doctors to hold joint consultations.
Yeah,
And
yeah.
in fact, one of his last words were that the show must go on. So yes, and you are taking his legacy forward. It's really heartening to see the kind of work and effort that you're putting in.
Thank you.
So then moving on to a question on, what exactly is the, larger social objective of HCFI? And within that, what kind of initiatives is the organization leading?
Sure. So Heart Foundation of India was started in 1986. Really, at that time, my father, Dr. K.K. Aggarwal, started it with his mentor and guide, Dr. Colonel Chopra. Um, eh,
Mhm.
Dr. Deepak Chopra, who was Dr. Colonel Chopra's son, was also one of the founding team members of the NGO, helping shape the vision on the overall mission of how do you make health and well-being accessible to the larger segment of the population. We really
Right.
look at three things, right? Prevention. So how do we impart the right kind of preventive education especially amongst school children, college students, because that's where the
Okay.
formation years of preventive health education is.
Mm.
Second is helping people who already have an illness. So that's where we have projects where we are helping those who can't financially support themselves but may need a heart surgery, may need some sort of doctor advice, intervention, hence the COVID helpline and everything. And we also
Mhm.
have programs of life after death. So how do you revive someone from a sudden cardiac arrest because someone dies in
Right.
front of you? You can use CPR to bring them back to life for the next 10
Absolutely.
minutes. Our
Hmm.
guiding principles as an NGO is to look at the concept of One Health, right? So we believe that the entire ecosystem of, it's not just healthcare can't be seen in isolation of
Absolutely.
the
Yes.
environment that you live in. So we also
Hmm.
have an environment division, which is run where we plant medicinal plants across villages in India. We take up the cause of environment pollution, could be air pollution, noise pollution, water pollution, etc. Right? So how do we really create a healthy ecosystem to be able to support the preventive health journey of everyone? Those are the aspects that we look at.
Okay, and you were talking about preventive interventions, and we've heard about HCFI's perfect health melas also. So I would just wanted to know how successful they have been, and can they be scalable and replicable by other, organizations within the industry?
So last year we did the 30th edition of the Perfect Health Mela. So we've been doing it for 30 successful years. During
Mm-hmm.
the pandemic, we did two online editions. Last year was a physical event that we did again. Whole idea of the Perfect Health Mela is how do you get students from medical colleges and schools. So we have a network of about 300 plus schools and about
Okay.
150 plus medical colleges, nursing institutions, and other colleges who kind of collaborate with us through the year, and especially during the Perfect Health Mela. Um,
Mm-hmm.
so it's basically over the years, of course, the number of days that the Perfect Health Mela is run across, there's been a range. So anywhere between 3 to 10 days is when the Mela has taken place.
Okay.
The whole format of the Mela is, it's really like a Diwali carnival, right? We always do it between Dashera and Diwali. We
Okay.
pick that time because there is such a festive mood in India. People are going to all your Diwali Melas in Delhi NCR. So the whole idea behind the Perfect Health Mela was how do you bring in entertainment to impart preventive health education, right? So the whole concept of
Mm.
entertainment. So you have lifestyle exhibitions, you have health checkups, you have performances, you have a Sufi night, you'll have a
Okay.
Western dance night, you'll have musicians coming in, but you'll have a fashion show. But everything is
Mm-hmm.
themed around health and wellness, right? So the whole concept of One Health comes in. So we have hundreds of schools. I think last year we had about 4,500 students coming in who competed in inter-school and inter-college competitions around. Again, if it's a fashion show, it'll be around, say, sustainability and how do you reduce pollution or heart health, or
Okay.
it could
Okay.
be how air pollution is affecting respiratory health. So the themes are like that. But you see amazing
Okay.
performances in the kind of concepts that people come up with. A Nukkad Natak on CPR, right? Uh,
Mm. Mm.
we'll talk about the healthcare benefits of dancing through the Western dance competition, right? So
Mm.
everything has a theme and everything has a message, and every person who visits the Perfect Health Mela goes back healthier with some sort of a health message to follow. People come in, they learn CPR, they go through mental health counseling, they'll go through, they'll go to the stalls where there is free, completely free medical checkups being done. Doctors are sitting there. All of those activities happen as a part of the Perfect Health Mela. We also have pre and post sort of awareness activities.
Okay.
Every 2 weeks we do sessions with school students and college students where we get an expert to talk about preventive health, to help answer their queries. We'll have 500, 600 students on Zoom coming and really
Mm-hmm.
asking their queries. We've had people who are 7 asking us about, obesity and how they may have some sort of they're just curious, right? They don't necessarily want
Mm.
to go and ask their parents or their teachers, so they come and ask us those kind of things. So Perfect Health Mela has been a very successful initiative. Thanks, and it's the again it's continued because the support that we get from a lot of our school principals and the college principals and teachers who continue to
Mm.
support us, continue to kind of gather together all the different institutions and work together as co-hosts and partners to make this a success and to make sure that we're imparting preventive healthcare education as much as possible.
Yes, and it's true that, the future generation should be well equipped and aware about, uh, healthcare. But besides academic institutions, are you also exploring forging partnerships with corporates or other NGOs or implementation partners, who
So
can
we
help?
do. So we do partner a lot with different bodies and institutions and things like that. For
Mm-hmm.
instance, in the past 3 to 4 months itself, we've trained 50,000 people in hands-only CPR for revival after sudden cardiac arrest. That's one of our flagship projects that we run. In total, I
Okay.
think now we've trained over 4 lakh people.
Mm-hmm.
For instance, we partnered with the Delhi police and trained every single PCR van that exists. We work
Okay.
with multiple corporates across as well. We've done some projects with, MedLife, India Medtronic, etc., where we've trained not just their staff on hands-only CPR, but also
Mm-hmm.
their partners, their sort of customers, etc., and come up with programs. Recently, we tied up with the district magistrate of East Delhi and trained
Okay.
every school, college, all the cadets that they've trained, etc., in that area. So about 37,000 people plus were
Wow.
tapped through this activity that's been going on with them. We recently tied
Mm-hmm.
up with even a media house for their programs that they were doing towards teaching people the importance of hands-only CPR. So that's a very, very strong project that we've done. We've seen so many success stories come out of it. These success stories are amazing. A 16-year-old girl went home. Her mama came over for dinner and he collapsed.
Mm-hmm.
The
Oh,
mother tried to push her out of the room, saying that kids shouldn't see that someone's passed away. She locked her
oh,
mother out of the room and said, I've learned CPR this morning at school. And she started doing CPR on her uncle and she saved him, right? Where the whole
wow.
family had accepted the fact that he passed away and, they were just crying. This little girl kind of jumped in and started saving the person. And we see success stories like this so regularly. We've seen an
That's
80-year-old
incredible.
save his 78-year-old wife while the kids were, just looking for an ambulance to kind of get her to the hospital and things like that. And by the time
Mm-hmm.
the ambulance came, he'd already saved her, right? So
That's
what we
incredible.
yeah, what we do is we use very, very easy to understand lines and sutras and phrases so that everyone from a young child to an elderly person can understand how CPR works. Um,
Mm-hmm.
what is the importance of it? Every person that we know of will know someone who's passed away because of a sudden cardiac arrest. And after that
Mm-hmm.
happens, you ask them, did you do CPR to try and save them? Because if it's done within 10 minutes, a very large section of the population can actually be brought back. And that's when they
Right.
start regretting it because they realize they didn't do it. So that's where we're partnering with a lot of corporates,
Mm-hmm.
government organizations, schools, colleges to continuously train people on hands-only CPR.
Okay, great. So, and like in a lot of other countries, there have been, usage of mobile apps and even VR, educate people about CPR. So, are you also leveraging technology somewhere to expedite the
Yeah,
efforts?
yeah. So from a technology aspect, so again, because CPR is something, one is, we've used gamification and we've tried all of that.
Okay. Okay.
But people often don't feel confident enough to actually do it in that situation. We've got calls from people saying, what if
Hmm.
I break the person's spine?
Hmm. Hmm.
What if I break the rib cage? What if I injure them? But they're
Ah, right,
already dead,
right.
right? How long? It's very easy to fix someone's a broken bone than to actually have them not survive. So we do believe in the physical training aspect of it. We do use digital mediums to train them as well and to kind of give
Hmm.
them resource material to be more
Ach-
confident, kind of understand all of that. But our focus across at least the key metros right now remains to physically train as many people as
Okay.
we can. We have dummies, we have trainer dummies, we have practice
Hmm.
dummies. So I mean, we have a Limca Book of World Record where we've trained about 11,500 students in one day. So,
Wow.
so that's the kind of scale that we look at from trainings. It's so simple to learn. We do train people virtually as well, but the impact of CPR learning in particular is much, much more when you do it physically. Of course, we use the virtual medium to reach as many people as we can through regular webinars,
Mm-hmm.
through the talks that we do, through a lot of patient education material that goes out, training sessions, etc.
Okay. Just wanted to know the scale and geography that you are trying to reach out with your interventions.
Sure. So I mean, we have, like I said, we have health educators across India who kind of take forward Heart Care's mission. This is done throughout the country. Our physical
Mm-hmm.
events from like the Perfect Health Mela takes place in Delhi. From an
Mm.
environment standpoint, we've adopted about 110 villages across India where we do
Okay.
medicinal plants. We
Okay.
plant medicinal plants. So our geography is quite varied, right? We have Mr. Vivek Kumar, who's also a trustee of the organization, who leads efforts out of Bangalore. So
Mm-hmm.
it's at a lot of different projects and things like that happening out of there. Even through the corporates that we function with, we've done CPR trainings in the smallest and the remotest areas to the largest cities across countries. So we have trainers across India. We're able to do, reach them through and through. Even our health educators, from a preventive health standpoint or medical advice standpoint, are
Mm-hmm.
there throughout India. I think in they're all based out of various locations across India. So they support activities out of there. So we truly believe we're actually an international organization if you think about it, because we also have health educators sitting out of Singapore, San Francisco, who are
Okay.
taking forward our communication. We, in fact, had a 17-year-old who did a fundraising activity from us. He's a student out of a school in, California. He and his
Yes.
fellow students came up with something, a property called Magic, which is
Mm-hmm.
creating virtual and physical music concerts across the US, and raised
Okay.
money to be able to support heart surgeries as a part of our project called the Heart Care Foundation Fund.
How
Here, how
wonderful.
it functions is we, with a priority for girl children, but we also take other cases. We have a committee that assesses anyone who's in need of a heart intervention, and now we're also exploring expanding that beyond cardiac illnesses. So we have a tie-up
Mm-hmm.
with Medanta Hospital and National Heart Institute, etc.
Okay.
Where, say, a rickshaw puller has a 6-month-old daughter with a hole in the heart, born with congenital heart disease, and is in
Mm-hmm.
surgery. But how will that person with 4 other children afford a surgery, which is a couple of lakhs? It's not
Mm-hmm.
possible. So we raise funds for kids like this. Our committee appoints them. We, to get the surgery done at a subsidized rate, and then kind of adopt these children as a part of the NGO. We also provide them mentorship when needed, guidance for their careers. So some of the kids we helped, say 7 8 years ago, they're now either getting into college or they're in school doing very well for themselves. They reach out to us for some sort of advice, career advice. A lot of them want to become doctors because how their life was saved and things like that. So we do multiple such activities. So this group of Magic really raised funds and supported these kids. So we have those kind of people also helping us from
Lovely.
across the world.
Wow. That's great. That's great. So, if we talk about, success of a project at the ground level, there's of course, the importance of the community being engaged
Yeah,
within that project. So if you could, share what is the strategy on that front, how do you engage the community? And if there are any success stories that you'd like to share where a community member has become a volunteer or
yeah,
has,
yeah,
transitioned from being the person who needed help to helping others.
yeah, yeah. So we have multiple such people who come forward and help us. And one, of course, Dr. K.K. Agarwal had his own clout, right? People
Right.
saw him as a legend, and people saw him. So in fact, we have even these health educators that I mentioned. Each one of them was a patient. Each one of them
Oh,
was a
okay.
patient who was helped during COVID. So Dr. Agarwal used to say, They used to ask, sir, what's your fees? He would say, your fees is you become a health educator and you help me educate other people who are suffering from, who are living in the fear of COVID, right? His whole
mm,
ideology was, how do you remove how do you take the fear out of COVID? um, People would call up and panic and say that, okay, what if what if I land up in the hospital, what if something happens to me? So the whole purpose of having these COVID educators at that point, who he would train himself, was to
mm,
not provide medical advice, but was to tell them that I lived with it too. I recovered.
mm,
This is
mm,
how, these are the things that helped me. Prone position, breathing, ghar ki nuski, these are the things that helped me. Giving that confidence to that person, telling them what home isolation was, and then getting them the medical advice that they needed, or pointing them in the right direction, that if there's a crisis that's happened, who do you reach out
mm,
to? How do you go about with hospital beds? So, I mean, that's the biggest cohort of people who are patients who turned into volunteers. It's a mix of people. There's a lawyer, there's a businessman, there's a homemaker. People. I remember people called us. There are people from tier two, tier three, tier four cities who are part of.
mhm,
All of that, all giving volunteering their time towards helping others. Even some of our directors and trustees, everyone works on a voluntary
mm,
basis, giving their time. We have Dr. Anil Kumar who's working with us. He's the
mhm.
he was the former environment head with the Delhi government. Uh, he's been leading our environment division. Mr. Vivek Kumar,
Okay.
who's the trustee, he's the one who's heading Clark's group of hotels across.
Mm,
Gives us leadership and guidance through and through. So I mean, we have people from grassroots and we have people from the top strata of the society who are all kind of working together to really help one carry Dr. Agrawal's mission, to make sure that the work happening at Heartcare continues on, and to make sure that people are benefiting from the work that's being done. Because
mhm.
that's the sole purpose, right? How do you help?
Right.
How do you prevent disease? How do you help sort of people living with the
Mm,
disease? And how do you look at the future generation, etc., and make sure that we leave them with a healthier and a more livable world throughout. So I mean, like that, we have multiple projects.
mhm,
Even our environment project with 110 medicinal plants, that was to help the community. That was
mhm,
that was really to help the entire community kind of look at how do you build sustainable models, how do you give them access overall, how do you kind of
mhm,
help them through and through. So each project is aimed to be from is really looked at from a sustainability perspective as well. How do these become sustainable activities
mm, mm,
can be
mm,
replicated by anyone and everyone also.
mm, mm. Then, but if you look at, despite the efforts the organizations like yours have been making in, trying to democratize the access to, especially cardiac healthcare,
Yeah, yeah,
quality cardiac care, it still remains a big challenge in the remotest areas of
yeah.
this country. So, can you know shed some light on any challenges that you've experienced and also share some solutions that can be again replicated by your peers and others in the industry?
Yeah. So, I mean, I'll just give a few examples, right? If you take the Heart Care Foundation Fund, all our patients are coming from remote villages, right? They're not coming from necessarily from a Delhi. They're coming from
Hmm,
the outskirts
hmm,
of areas. People are traveling for hours to come. So it's an easily replicable model if more hospitals come forward and kind of tie up with us. We have Medanta and we have National Heart Institute. So and even other organizations, right? Of course, down south and stuff, there are some organizations which are doing similar work towards providing free surgeries, towards even with CPR, it's so easy to replicate across. It could be an entire delivery fleet, for instance, which is trained in
hmm,
CPR. Or it could be
mhm,
trained Delhi police, because I'll give you the ideology behind training Delhi police. The whole aspect of it was that an ambulance will take you about 15-20 minutes to reach.
Right.
Local Delhi police PCR van will reach you, is always around your colony, right? Or your area. That's where
Hmm.
they're posted. So they will reach you between 0 to 10 minutes.
Hmm.
So if they start CPR, and CPR is most effective within 10 minutes, so the
Yes.
number of
Yes.
people who are saved, reduces by
Okay.
by a large number. This is so easy to
Hmm.
replicate. I mean, CPR is not rocket science. CPR, even a child can learn. We've seen through our case studies and
Hmm.
success
Hmm.
stories. CPR is a very easily replicable activity by, for organizations to tie up with us or do it on their own. It has become a national priority with all the celebrity deaths, etc.
Hmm.
Even an environment project, medicinal plants is, again, it's, you're providing pollution, you're tackling the thing of pollution as well. You're
Climate
tackling the
change.
thing of going back to the roots and giving them access to medicines, or at least from a preventive to a mild disease aspect of it.
Hmm. Hmm.
Even when you said, Dr. Agarwal's last words were, the show must go on, he spoke about how doctors must come together and volunteer,
Hmm.
even some time towards helping others, right? That was also a collective
Right.
movement during the pandemic, that how do you
Hmm.
get people to come and help out, whether it's in a tier two city, tier three city. That's
Hmm.
where telemedicine helped. We had people from the remotest villages calling us. We had doctors
Hmm.
from across India volunteering on a Zoom OPD, right? Something as simple as a Zoom OPD, which was free of charge. Everyone has a smartphone these days, so it's not
Hmm.
very difficult for them to just log on and ask their questions. So telemedicine has definitely really helped reach the masses. So all of our programs and all of our activities are very easily replicable sort of models. I know of organizations which do healthcare and wellness melas also across India now,
Hmm.
right? We were the first ones to do it, but we also have something called a health parade. We do
Hmm. Hmm.
where schools can come out and walk on World Health Day, with slogans, raising some awareness in their communities, in their areas. Yeah, so basically, it's an open it's an open ecosystem. NGOs must collaborate with each other. Governments must collaborate with NGOs to actually truly reach grassroots level organizations. That's why we've been tying up with the district magistrates,
Hmm.
with their program, really scaling our efforts with media houses, with
So, Nina, have your initiatives in any way, kind of influenced the policies or the strategies as at the political at the government level, if you have any,
Yeah, so we also have something called the HCFI legal cell, where
Mm-hmm.
we've got multiple PILs that have been going on since many years. In fact, Dr. Agarwal used to fight his PILs on his own, and he used to argue those on his own, because law
Mm-hmm.
was also a side passion of his while being a doctor, and a philanthropist. In fact, one of our PILs was on AEDs, which are defibrillators,
Mm-hmm.
for cardiac resuscitation in public places. That is something that did impact policy and the law or legal
Okay.
framework
Okay.
overall. So like that, we have multiple different PILs that are ongoing. This was one of the biggest ones because AEDs must be there at public places. With the government, we also did a lot of anti-tobacco campaigns, and
Okay.
those campaigns which also, which when Sheila Dikshit was in bar, had a lot of sort of impact, and she's the one who flagged off one of our we did a cremation for Mr. Tobacco at that time, and this was the early
Mm.
90s, where a campaign like that was very, very unique, to be able to raise awareness about what tobacco can do to your health, and things like that.
Mm-hmm.
So we do actively look at policy change as well, through the various PIs that we take
Okay.
up, being a part of a lot of committees within the government ecosystem and things like that. How do we advise or be a part of the discussions?
Mm-hmm.
Being very prominent, especially with CPR in particular.
Okay. And have you also tied up with any research institutions to help to take this forward, any kind of advance in technology or medicine to do with healthcare, cardiac healthcare?
So, from a research standpoint, we have something called the Dr. K.C. Aggarwal Research Fund, which looks at pandemic and like illnesses. This is a research fund that we have internally. So, we have medical researchers, etc., who look at all the data because we also collect a lot of data through the
Mm-hmm.
workshops, through the campaigns that we do. That we also do a lot of free flowing surveys and on ground data collection to be able to see where we can make a difference, where are the gaps in
Mm-hmm.
preventive care
Mm-hmm.
overall, and how do we, publish those. As a part of our communications, not as a part of the NGO, but we have a communications company where we have access to doctors and magazines and books and which reach the healthcare fraternity, where we are able to publish these papers and
Mm-hmm.
they do published work. So we use that entire network to really kind of amplify the messaging that we go out with. So the whole idea is to also share that key insights of what are the gaps in the healthcare ecosystem, with like-minded. So every alternate Saturday we have a stakeholder meeting that also happens, which has
Okay.
former heads of different committees of government, or it
Oh,
has
great.
vice chancellors of medical institutions who'll have, people with authority. It could be the
Mm-hmm.
ex-CEO of NABH, who was also very closely associated with our NGO and was giving his voluntary time to us. So all of these people would come together and really talk about, a professor from AIMS, someone from Maulana Azad. All of them would come
Mm-hmm.
together and debate what are the challenges, what are the
Mm-hmm.
gaps, how do you utilize the data, how do you come up with the right solutions. So we do have those stakeholder meetings. So the healthcare stakeholder meetings usually happen on Saturdays, depending on their convenience. On Sundays, there's an environment stakeholder meeting. So again, like-minded individuals who've been championing environment efforts, they come together. They'll talk about topics like pollution. They'll talk about waste management,
Mm-hmm.
recycling, adopting parks. In fact, we created a model where we created a model park where we adopted
Mm-hmm.
a barren and created it into an entire park full of flowers, medicinal plants,
Wow.
um, made it environmentally sustainable,
Mm.
and became a model park because then we would go to RWAs and things like that and say that this is how you can replicate this. Um,
Absolutely. Mm.
Within your own ecosystem. It doesn't take too much. Your own residents can take care of it. So we also
Mm.
take up those kind of activities. We do in schools. We are teaching people how to make sparrow nests. Just from a
Nice.
conservation perspective.
Absolutely. Healthcare and environment are two codependent,
Yeah.
sectors.
So
Yes.
research is the base
Yeah.
of what we do, and getting
Mm.
different stakeholders from the ecosystem involved is also a key
Mm.
focus for us, and that's why we've got so many like-minded individuals who come together. We also, do the on 5th September we do the HCFI awards, where we
Mm-hmm.
award people who actually make a difference in the larger ecosystem, right? It could be people who've saved patients through a voluntary ambulance that they're running, or
Mm.
someone who's been
Mm.
educating children about healthcare aspects, or looking at sanitation, or looking at women's healthcare, etc. So it's really about creating an entire community together and getting more and more people involved.
That's wonderful. So my concluding question to you, Naina, would be that, with a growing focus on holistic wellness, how is the organization expanding its reach to address other critical health issues in India? And what is the roadmap for the future?
Yeah. So for the future, one, like I mentioned, from a disease standpoint, we want to go beyond just the heart surgeries that we're doing. We are also an accredited NGO by the Ministry of Ayush. So we have yoga as a key program in what we do, where we are
Okay.
trained. We are accredited to train institutions and certify them as yoga, bodies and wellness centers and things like that. So there we also have, we run some courses on basic elements, basic yoga teachers training programs, etc. because again, we believe in the integration of medicine overall from a wellness ecosystem that becomes very, very key.
Hmm. Hmm.
Going forward, CPR is definitely going to be a key program for us. India's woken up to how important CPR is. We've been doing it for many, many years, much
Hmm.
before any media reported it and spoke about it and things like that. So tying up with many, many more corporates, schools, colleges, institutions to be able to take CPR training to the remotest areas, because that's the easiest way to save lives, right? Anyone
Yes.
can do it by the end of it. So that is a project that we will be scaling throughout. Also, we're figuring out how to make, preventive health more accessible. How do we use, like you said, how do we use technology to integrate and, looking for the right kind of partners to support us to do all of that, not just in India, but how do you make everyone aware of the kind of work that's being done, or that needs to be done, and replicate scalable models across, and how do we use the data that we are in the right way to communicate our
Hmm.
message, to share that for as a learning, and what are the gaps that exist in the larger ecosystem overall, through and through. So I mean, those are some of the key priorities and focus areas for us going forward. And the whole idea is, how do we get more and more people involved, so that we can reach more and more people through our efforts.
Great, great, Nana. It was a very heartwarming discussion, I would say. Thank you so much for all those enriching inputs. And it's commendable to see the kind of work and the kind of reach HCFI is making. And we wish you all the best. And we will give you all the support that is needed. Uh, and thanks once again for giving us this opportunity and talking to us.
Thank you so much. Thank you for having me, and for giving us the opportunity to talk about that work that we're doing to really highlight Dr. Agrawal's legacy, even though he doesn't need any introduction. Uh,
Absolutely.
it's great to see people supporting the NGO even now, and that's something that's exactly what he meant when he said the show must go on. So
Yes.
that's really what's the mission.
Thank you so much, Nana.
Thanks so much.
Thank you.
Thank you.